Okay, we will continue the video with the neck. We will inspect the neck area. Sorry, my hands are cold. You're inspecting for symmetry. You want to make sure that you're not feeling any swollen glands. You want to check all of the lymph nodes. So we will start with the pre-auricular, the post-auricular, the occipital, the superficial cervical, the deep cervical, the posterior cervical, and the supraclavicular, and then the submental is up front and submandibular in the back. So you want to go ahead and feel all the lymph nodes. Make sure you note if anything is swollen or the patient feels any tenderness during that evaluation. I am going to listen to the carotid pulses one at a time. First, I will gently palpate, and the other side. And then you want to listen with the bell of your stethoscope. You're listening for any bruits. Hold your breath, please. Okay, take a breath and hold your breath. Okay, and I do hear those carotid pulses when the patient is holding their breath. You want to look at the trachea, make sure it is midline. You want to assess swallow. So let me grab a glass of water. I'm going to go ahead and inspect the thyroid gland and have you swallow. And I'm going to watch while you swallow. Make sure I can see it. Movement. Very good. And we're going to test cranial nerve 11. And I'm going to have you shrug your shoulders up and down. And put your ear to your left and your right. And your chin forward and backwards. Any pain with any of that?
Nope.
Okay. And while we're doing that, we're looking at these muscles all in here, the trapezius and sternocleidomastoid, making sure that nothing is abnormal. I'm going to go ahead and look at the back and listen. I'm going to go ahead and look at each vertebrae going down the spine. You can notice if the patient has any kyphosis, lordosis, any kind of scoliosis. Her spine looks very straight to me. You're going to put your hands on their back. Actually, let me have you turn sideways. Perfect. And you're going to have the patient take a deep breath in and out. And your hands should equally move as the patient does that. We're going to go ahead and percuss. You're going to percuss the lungs. And then you're going to listen. You listen with the diaphragm of the stethoscope. Just breathe normal. Okay. Now I'm going to do the front. You also want to be looking at the skin while you're assessing lungs. You want to make sure that you're hearing good air exchange on both sides, which would be a bronchovesicular sound. And in women, you want to come to the side to listen to the lung sounds on the front. and under the breasts. Very good. Okay, we are going to listen to cardiac sounds, and then I'll have you lay down also. We're going to do apical, and I will have you lay down. Thank you. And the mitral area of the heart, you're going to listen with your bell as well. Make sure that you don't hear any adventitious sounds or different heart sounds. Okay, we're going to do the abdomen. So you just want to view the skin, and you want to just view the abdomen, and then you want to listen. You're going to start in the lower. You're listening for vowel sounds, lower quadrant. And then you want to percuss the abdomen. And then after percussing, you want to lightly palpate. And then you want to do a deeper palpation. And you want to measure the spleen. Where's my measure? So with the spleen, you want to use a tape measure, and so you want to feel the top of the spleen, or liver. Sorry, this is the liver, and you want to measure, and it should be between 4 and 8 centimeters. Then you want to go for the spleen, which is on the left side. We want to feel femoral pulses bilateral, and you kind of have to get in the groin. And you want to listen to the abdomen for the aortic artery, renal, and femoral. Now I'm going to just have you propped up a little bit more. I'm going to look at your jugular venous. Maybe that. Perfect. Okay. So for the jugular venous distension, you want to view there, make sure you don't notice anything out of the ordinary. And I'm going to have them turn her head away from what I am trying to measure. Okay, I will have you look at the couch. And then you want to have a ruler, a smaller ruler would be better. But you want to measure. Okay, look back this way. Okay, I'm going to test your strength in your lower extremities. So lift up against my resistance and the other side. Okay, good. And then your arms, push out. Okay, other side. Okay. Okay, if you could sit up so I can check your deep tendon reflexes. Okay, so just relax. And you want to check the epitrochlear lymph nodes also. And then you also want to check the pulses, the brachial and the radial on both sides too. And we'll do the reflexes on the knee. Relax. Barely. Okay. And I'll have you stand up and walk heel to toe. Heel to toe. Heel to toe. Okay, and then go backwards the other way. Okay, and just stand in one spot, and we're going to do what's called the Romberg test. And I'm just going to have you stand with your arms at your side and make sure there's not any swaying. And after observing not any swaying, I'm going to have you close your eyes. And there's not any swaying, so balance is sufficient. I'm going to have you put your thumb to your forefingers on both hands. Okay, now do them separate. Okay, okay, perfect. Okay, and I'm going to look at your spine while you touch your toes. Okay, and back up. Okay, very good. You're free to sit down. Thank you very much.